I mean, we have so many different courses, and it's really exciting to see what you can do with it. And we've got this idea now of creating these reusable, immersive learning objects. So we can create a scenario. Once we've invested a bit of time in it, we want that to be something that can be used across the board, not just in one course, but in several courses. Could be used in a medical course, but it could be used in a CLIL course as well, in which they're studying the language, this technical language related to a subject. So we're looking at trying to use our time wisely and invest in the right things. So this is quite an exciting example now of putting somebody in the shoes of someone who's having radiotherapy. It loads very quickly. This is our virtual learning environment. And you'll see that now this is not a static image. You see a person walking in. We've got live 360-degree video, and we've got audio narration coming from real patients. So we've taken that audio, got permission to use it, and as soon as they click on those audio hotspots, they hear the patient speaking, and they're getting that audio input in context. You've got a multiple choice question here. If they get the wrong answer, they get immediate feedback. If they get the right answer, they just get a little star. Those stars get collected on the floor. So as they walk through the different scenarios, they can see how well they're doing and get that sort of immediate feedback. But the whole idea here was to put somebody into the shoes of someone else, get them developing empathy, start thinking about how they would feel in that situation. And from the perspective of language, focusing on the language of the professionals and then thinking about whether they would improve on that language, whether there's a better way of explaining something that would make the patient feel more comfortable or a friendlier way of saying it. So looking at the register and the tone, because very often people who do this job every day get quite technical, and they refer to it as you're going to get into the machine, rather than saying we're going to put you into the treatment equipment now, and things that just soften the experience a little bit. So you're having a mask put over you, you're just about to undergo radiotherapy, you want to find out a little bit more about it, then you can see a more detailed video in which somebody is giving you that input just at the moment when you're about to have that process done to you. Now, the questions that were embedded in there, we get immediate feedback. We can check on the students and have a look and see how many students have answered the questions correctly, and that's really important. Just to give you an idea of whether the questions are too easy, too difficult, where are the stumbling blocks, and can we go back in and do something about improving that learning journey. And then we can also look at, for me this is one of the most interesting things, we can look at the learning pathways. So if you're creating an interactive scenario that's non-linear, so there is no definite correct path to take through it. There's a branching narrative where the students are making decisions, and that's taking them off into different directions. It's really interesting to then gather that data and see what paths the students are taking and how they're getting from one place to another, what decisions are affecting that. So that little strange diagram on the left there in the lower left is just showing the path of one student and how they've looped around. Where it says all done, that's not the end, that's just the name of the clip, because one of the radiotherapists says all done. So there is no start point or end point, it's just a question of what path the student chooses to take through that media. And I think that sense of agency and control is really important.